Hey there, future nurses. If you're prepping for the NCLEX, let's tackle hyperthyroidism, the high and hot endocrine disorder you can't afford to miss. Hyperthyroidism means the thyroid gland is on overdrive, pumping out too much T3 and T4, which sends your metabolism into high gear. This is the opposite of hypothyroidism, where everything's slow and low. So what causes hyperthyroidism? The big one is Graves' disease, that's autoimmune and often comes with eye bulging or exophthalmos. Other culprits include toxic nodular goiter, thyroiditis, and too much iodine. How do I spot it? Think high and hot. Patients show signs like tachycardia, heat intolerance, nervousness, sweating, insomnia, and weight loss even though they eat more. You might see fine tremors or even anxiety. Always remember, if you see severe symptoms like delirium, fever, or extreme tachycardia, think thyroid storm. That's a medical emergency and can be fatal if you don't act fast. Lab values are a big NCLEX focus. Hyperthyroidism shows high T3 and T4 but low TSH. That's because the pituitary sees all those extra hormones and tries to shut things down. Let's talk nursing care. First, monitor those vitals relentlessly. Heart rate, blood pressure, and temperature are your best friends here. Administer antithyroid meds like propylthiouracil or methimazole to lower hormone levels, and beta blockers to help with tachycardia and tremors. Watch for medication side effects like agranulocytosis with antithyroid drugs. Patient teaching is huge. I remind patients to avoid heat and strenuous activity because they're already in overdrive. Emphasize sticking to their medication schedule even if they feel better. Stopping suddenly can be dangerous. Nutrition and hydration matter too. These patients burn calories fast, so they'll need extra fuel and fluids. And if surgery or radioactive iodine therapy is on the table, teach them what to expect and watch for post-op complications. Finally, always watch for thyroid storm. If a patient suddenly gets worse, think high fever, agitation, confusion. You need to act right away. So, quick review: hyperthyroidism is high and hot with high T3 and T4, low TSH, and symptoms that crank up the body's engine. Nursing care is all about monitoring, meds, education, and emergency response. Thanks for hanging out with me. For more NCLEX tips and detailed breakdowns, check out www.brispainternational.com. You got this.